Hello, good morning, everyone. My name is Liz Ayers. I'm a faculty member at RIT, and I also work with the Deaf Healthcare and Biomedical Sciences Hub. Today, the Deaf Hub is very excited to welcome Marita Løkken. Marita is deaf, a trained medical nurse, and holds a master's in disability and society. She is currently a university lecturer in the Bachelor's of Arts program in Norwegian Sign Language and Interpreting at NTNU. That's the Norwegian University of Science and Technology. NTNU is in Trondheim, Norway. Marita will explain more about NTNU during her presentation. Marita will soon be graduating with a PhD in Professional Sign Language Competence, and that will be from Oslo Metropolitan University. Her research interests include deaf experiences, sign language, health, communication, and interpreting. The structure of this webinar is that Marita will be using Norwegian Sign Language, and then we have our American Sign Language interpreters here, and we have voice interpreters who are going to be off screen for this webinar. When Marita is done with her presentation, there will be time for a question and answer session. We would ask that questions are submitted via the Q&A portion of Zoom. We'll turn things over to Marita.
Great, let me get my slides up here. Okay, I think I'm ready to go. First, I would like to say thank you to the Deaf Hub so much for inviting me to give this presentation. This is my first time presenting with deaf interpreters. It's a new experience for me. My name is Marita Løkken. This is my sign name. Today I'll talk about my experiences from childhood, growing up, and how I got to where I am today. You see the pink country map of Norway. Trondheim is here in the middle. That's the city of Trondheim. I was born here in Trondheim. I'm the first deaf person in my family. My parents are both hearing, and they weren't sure what to do with a deaf baby at first. They are hearing, but I love them very much. They did their best and they did learn sign language. As a baby, they noticed that something was different about me. They saw that I often got up and wanted to look around, and I constantly wanted to stand up, sit up as much as I could to be able to see what was going on around me. And I had no response to sounds. If there was something loud in the background, my parents noticed that I really wouldn't look around or react at all. So they suspected pretty early on that I was deaf. And they brought me to a doctor, an audiologist, and told them that they thought I was deaf. And the doctors at first said that I was not deaf. It wasn't until I was 6 months old that finally the doctors recognized and realized that I am deaf. I had my first hearing aids at 6 months old. Back then, I had the old-fashioned hearing aids that had wires connected to a box that I had to wear on my chest. As I grew up, we eventually the technology improved and I wore hearing aids growing up. When my parents found out I was deaf, they looked in the phone book and they found the Trondheim Deaf Club. They found the address for the deaf club and they decided to just take me to the deaf club and figure things out from there. So they brought me as a baby. At that time, I was the first deaf person. They didn't know any sign language. I was the first deaf person they had met. They didn't know any sign language, but they went to the deaf club and explained the best they could that their baby's deaf and they were worried about me. And the other deaf people at the deaf club said that you have nothing to worry about. There's no problem. No problem at all. They suggested, because my parents weren't sure whether they should encourage me to use spoken language or sign language, but the Deaf Club encouraged them to do both, including sign language. And from the Deaf Club, my parents were able to learn sign language. My grandmother and my extended family also learned sign language too. I'm very fortunate for that. After 1 year, I also had a baby brother. My brother is hearing, but learned sign language from a very young age. So we were always able to communicate with each other in sign language. And sometimes other people couldn't understand us, which was pretty cool. When I started kindergarten, I went to a deaf and hard of hearing program for kindergartners. We used both sign language and spoken language. The adults who worked there were deaf and hearing both. And looking back at that time, my parents really noticed that I connected with the deaf adults who were working there in kindergarten. That was a very good experience for me. So you can see the same text, but the picture is changed. This is a different picture. And some of you in the audience may recognize this picture. This is the All Community College and All Folk Center. This is kind of the deaf hub of Norway, the deaf cultural center of Norway. All deaf people in Norway know about All. They host the Dr. Deaf workshops, writing retreats for deaf academics, research seminars for deaf academics. So deaf academics from all across the world come here to All for the programs they offer. My parents were fortunate to learn sign language from All Cultural Center as well as from Trondheim Deaf Club. The yellow box on the screen, I really want to emphasize the importance of having both of these cultural centers and both of these deaf spaces where deaf people can gather and be ourselves. And they're open for hearing parents and hearing people who have deaf family members to join the community and learn sign language too. On this slide, you can see the row of colorful houses, which is beautiful. That's a picture from Trondheim. This is a very famous part of town that's about 600 years old. These buildings were first built. I want to share some of my experiences from when I was a young child, and I don't remember them all very clearly. Some of them are stories that my parents have told me later. The first thing that I'll talk about is my birthday when I was 5 years old. As you know, for children, birthdays are a big deal. It's a very exciting event. You get presents, there's cake, there's a big gathering. I don't remember this specifically, but I don't remember all of the details specifically of this event, but I do remember how it felt. I was 5 years old. My parents had a big party for me. All of my extended family came over. And I remember being in the room and all of my extended family was speaking to each other. No one was using sign language. I was trying to read lips, but I really didn't understand what anyone was saying. And I felt very isolated. But it was my birthday. All of my family came to my party for me. My parents have told me this story later that I ended up standing up on a table and I yelled with both my voice and sign language. And I yelled, "You all came for me, but none of you are signing. I can't understand what you're saying, even though it's my birthday party." And from there, my family realized how I felt, and they did start signing after that at my birthday party. Some of them aren't fluent signers, but they did their best to sign as much as they could. And even a little bit of sign language is better than nothing. Another story, also from when I was about 5 years old, and again, I don't remember the details clearly, but my parents have told me this story. I did something bad. I got in trouble. And my great grandmother was there, and my mother was also there. And my mother took me aside and scolded me, told me not to do it again. And my great grandmother interrupted my mom and said, "No, she's deaf. You can just let her be. Just give her a chocolate or something. You don't need to scold her." And my mom said, "No, she's deaf and she needs to know what's right and wrong. She needs to know what's good and bad." My mom felt that it was very important to teach me that and to treat me the same as other children. So I'm very grateful for that and that relationship that I have with my parents. When I was a little bit older, I remember spending time with my cousins. When we were younger, we could play together pretty easily, but as we got older, my cousins didn't really know sign language, and so I became pretty isolated. So at family events, I would often just read a book in the corner by myself. I really loved horse riding, and so I read a lot of books about horses and horse riding. So my family would be talking to each other in the main room, and I would be in a corner reading my book. That happened pretty often for me growing up.
Now, as I got older, I remember being in primary school. I was about 7 years old, and my parents didn't know what school they should send me. They decided that I should be getting exposure in both a hearing school and a deaf school. So I went to a mainstream school for part of my day, which was great. That only went up to fifth grade, though. And that was helpful to be able to have the experience with other kids my age. But again, I was isolated because most of them use spoken language. Then when I was at the deaf school, I was finally able to fully participate in conversation, and I really had different identities at both of the schools. When I was in the mainstream school, I was a little bit more clever, I would say. I would read, I would do more work, I would get ahead in my work. I would kind of sit back and just do schoolwork, focus on the academics. The other kids were playing and I was reading. Looking back now, I almost think that unconsciously I was really using a strategy. It was a way that I was able to stay caught up with my hearing peers. And then I remember maybe being in 8th or ninth grade, so a little bit further in my education, and I was being taught English in school. In the mainstream school, the other children were able to listen to an audio book. It was actually a CD at the time, and it was being read in spoken English. And I had an interpreter, and they were interpreting into Norwegian Sign Language, which meant that I wasn't getting the exposure to English. After the children listened to the audiobook, they would break up into groups to do work, and my interpreter was still using Norwegian Sign Language. And that was difficult because I got more and more behind in learning English. My parents continued to push for me to get the education that I deserved. And so they focused on English with me to help me continue to learn that language. I would have individualized tutoring with a one on one tutor. And that's when the tutor or the instructor started telling me that I needed to focus on lip reading. And they were showing me the different mouth movements that came with English. And that's when I was finally able to start to understand. We would go back and forth, and I had been missing all of that for so long. Now, I was able to start to produce English, but I was still behind in school. Then I continued on with my education and I went to university. I went into physiotherapy, and that's when I realized that all of the studies were in written English. And again, I was behind. I had interpreters, but it was very different because now it was all academic English at a higher education level. And that's when I actually dropped out of university. That was in my hometown. And I went and worked as an assistant with other deaf people and finally had that connection with my community again. And then I thought, I might enjoy going into a nursing program. So I re enrolled, and that was good. I was able to have a dictionary that I could go back and forth with the English word and figure out what it meant in Norwegian, but obviously that took time. I invested the time to learn. And the program here in Norway is a 3-year program. About halfway through, so after a year and a half, the university came to me and they said, you should rethink your path. Maybe you shouldn't continue in this program. Now, mind you, I was told this information through a sign language interpreter, and I could see the impact that that message had on my interpreter. I asked why, and they said, Marita, you're deaf. And at that time, I was maybe 20 or 21 years old. I was living alone, not with my parents. And my home was a different city than my parents. So I actually rode the bus to my parents and told them what had happened at my university that day. Now, remember, my parents had always advocated for me growing up, but they said, Marita, it's now your turn. You have to advocate for yourself. They said, we'll help you, but you have to practice self advocacy. So we sent letters to officials, we sent letters to the school, and my parents continued to advocate. I continued to advocate to say that I didn't need to drop out. I could finish this 3-year program. The school allowed me to. I graduated, and then I started to work. I worked for 2 years in a nursing home, and I loved my job. And I was maybe a bit of a nerd, so I was always reading in my free time. I had always loved reading. I still loved reading, and I decided that I wanted to go back for even more education. So I went for my master's in disability and society. My supervisor at the time was hearing and an interpreter, and he was very involved with disability and society. And it was great because I had a supervisor who not only knew my field of study, but also knew my language. And that was a game changer. I focused specifically on deaf and hard of hearing people in hospital settings. I interviewed those individuals and I asked them about their experience with and without interpreting services. Now, at the same time that I was studying for my master's, I had a personal life. I have a partner. We now have 2 kids, and I work at NTNU. Plus, I'm a lecturer. We have a dog. Here's a photo of my dog. And all of that brings me to where I am now with working on my PhD. I'm a deaf woman, I'm a mother, I'm a nurse, I'm an advocate, I'm an educator. And all of those identities have been with me while I've worked on my PhD project. Now, I explained that I had lived in Trondheim, which again is about the middle of the country. But for my PhD, I've been in Oslo. And I commute back and forth to Oslo from Trondheim. And I work for Oslo Met. For 3 years now, I've been commuting. I have a supervisor who's Hildy Howland. And that's my main PhD supervisor. She's the first deaf professor in Norway. And again, having a mentor who not only knows the field and the language, but also the lived experiences that I've had has been wonderful. I also have a co-supervisor who's hearing, doesn't know sign language at all, but is in applied linguistics, and so focuses specifically on healthcare communication. And that co-supervisor has a different field of study than me and the main supervisor, but the three of us have been able to co-collaborate and very much help me get through my PhD dissertation. I have published 3 articles to date. The first one is published in Norwegian. The second 2 are published in English. And I'd like to share a little bit of information about all 3 of those. First, let me talk a little bit about how my project came to be. There were 5 deaf women who were all pregnant or had recently had babies. They went to the health center and they would talk with the nurses and the medical professionals. After the babies were born, they would talk about milestones, about weight, about vaccinations, about everything related to pediatric care of their infant. I followed those 5 deaf women. I followed them, interviewed them during or after their appointments. They allowed us to videograph them. And then after, we would have conversations, deaf women to deaf women. All 5 of them were recorded with an interpreter present.
This is the first article. This looks at the additional burden and work that deaf women have to do, again, after recently giving birth and taking care of their newborn baby. For this, there were 2 different groups or 2 different areas that I'm looking at. One is the systemic burden, and the other is the individual burden. One of the women I interviewed said that she lamented that right after giving birth, she has a newborn baby, her body is changing, she has to focus on breastfeeding her baby, taking care of her baby, and then at the same time, she also has to make arrangements for an interpreter. She has that additional burden of coordinating interpreting services for her doctor visits. To book the interpreter, if she calls the interpreting agency and finds that there's no interpreter available at that time, Then she has to follow up with the health clinic to schedule her appointment at a different time, and she has to go back and forth between those two different services. After giving birth, all of these women wanted to just be able to go to the doctor like normal, to be a normal mother, and to be able to focus on her and her newborn baby's care instead of having to worry so much about arranging interpreting services. Now, I forgot to mention earlier, I said that I interviewed all of the participants. I asked them a list of questions about their experiences with the health center, the nurses, and other information. In my list of questions, I had no questions about interpreters or interpreting services. I never asked about that explicitly. And yet, these five women I interviewed told me a lot of information about their experiences with interpreters. So that became a central part of my article, even though that wasn't my original intent. I have a picture of five figures on this slide. These represent the five women that I interviewed. Three of the five women did book the interpreters themselves. Some of them did ask the health center to book the interpreter for them, but the health center said it's too hard, they were resistant to it, and so those three deaf women ended up giving in and arranging the interpreters themselves. The fourth deaf woman wanted to book the interpreter herself. She wanted to have more control and she wanted to know who the interpreter was ahead of time for her health appointments. She also wanted to be able to ensure that she had the same interpreter every time. So she wanted to have that control herself, and she wanted to book interpreters. The fifth woman refused to book her own interpreters. She told the health center that it was their responsibility to book interpreters, and she would not do that. She advocated for herself, she knew her rights, and she told them that they were responsible for providing an interpreter. And so the health center did end up giving in and booking interpreters for her. And yet, that shows that deaf women have to really stand up for themselves, and they have to speak up, and they have to know their own rights to be able to convince the health center to do that for them. Of those five deaf women, four of them had different interpreters for every appointment. They often had interpreters that they had never met before. Those interpreters didn't know the woman, didn't know her baby, didn't know anything about her. And that was constant for all of their appointments. The woman I mentioned earlier who wanted to book her own interpreter made sure that she had the same interpreter consistently for all of her health appointments. From that, learning more about the burden that deaf women have, I also wanted to look at the relationship between the deaf women patients, their interpreters, and the nurses who were caring for them. Whether the nurses had a good or bad relationship and communication with the deaf patients, regardless of sign language, regardless of whether the nurses themselves use sign language. I found that the women knew consciously that they had to educate the nurses. And some of them were very confident in being able to do that, some more so than others. One example is a nurse said, "At night, when the baby wakes up, what do you do?" And there are alert systems that vibrate to alert deaf women. So the deaf patient explained that to her, to the nurse, and said, "That's how I wake up in the middle of the night when the baby wakes up." And then the nurse said, "Well, does the baby sleep well?" And the deaf mom said, "Yeah, the baby sleeps all night." And the nurse asked, "Are you sure that the baby alert system is actually working?" And the deaf mother said, "Yes, it is. I know when my baby is crying. When I'm at home, she often worries about her baby, and so she goes to check on her baby in the middle of the night. But she knows that the alert system works just fine." Deaf women often had the experience of being looked down on or assumed that they couldn't be a mother as well as hearing women. Some of them said that they made sure to dress up and look extra nice when they went to the doctor because they wanted to make sure that the nurse and doctor believed that they could parent their child. They felt that they had to do extra work to prove that they were a competent mother. That's in terms of the relationship with the nurse. Now, in terms of their relationship with the interpreter, again, most of the women had different interpreters for each of their appointments. So that put extra burden on them because the interpreter doesn't have any prior information about the deaf woman's health or her newborn baby's health. So the deaf patient had to do extra work in telling the interpreter that context and history of what was going on. Sometimes the nurse and the deaf woman would know what they were talking about, but the interpreter wouldn't understand the context of their conversation. One example is that a nurse said, "Oh, it's almost time for your baby to start school." And the interpreter thought, "For the baby to start school?" And the deaf patient explained, "No, I have two children. I have the baby who's here with me, and then the nurse is asking about my older child who's starting school soon." So the very first time that the interpreter meets the deaf patient, they don't know anything about what the deaf patient has, they don't know anything about the deaf patient before then. This is a picture of a doctor's appointment, and I'll explain everything in this picture. You see the deaf mother sitting on the couch with her baby in a car seat carrier on the floor in front of her. The woman is looking up at the interpreter and then also looking over at the nurse. The interpreter is the one sitting, and the nurse is standing further away. As they're talking, the baby wakes up and starts moving, and the deaf patient says to the nurse and the interpreter, "Wait just a minute," while she looks down at her baby. The nurse says, "Wait," but doesn't say it clearly. So the deaf woman picks her baby up out of the car carrier, is talking to her baby in sign language, and holds her baby in her arms. When she looks back up at the interpreter again, the interpreter has said nothing to the nurse. But the interpreter leans over and says to the nurse, "What were you saying a minute ago?" And then the nurse sighs, and then she keeps going again. This shows an example of a time when the deaf woman knows how to communicate with hearing people who are not familiar with a visual language and the needs of a visual communication. So when the deaf woman is not looking at the nurse, she's not being able to understand what the nurse is saying. And she asks the nurse to pause for a second when she pulls her baby out of the carrier. In sign language, for those of us who use sign language, we know that eye contact means that we can communicate and have a conversation. But when the eye contact is broken, we need to pause. The nurse did not understand that, and the interpreter did not do a good job of making that cultural mediation to help the nurse understand that she needed to pause for a moment. I'm looking at the time and it's going very quickly. So I may jump ahead a little bit here. I'll keep this pretty short. In this example, the deaf mother is sitting with her baby on the couch in the corner and she's breastfeeding. So she's looking mostly at the baby. The interpreter is sitting in front of her in her sight line. And then the nurse is sitting next to the interpreter, but the nurse is not looking at the deaf mother. She's typing on the computer and talking. The interpreter is trying to get the deaf mother's attention, but they don't have line of sight. The deaf mom is just looking at her baby while her baby is breastfeeding. The interpreter tries a little bit to get the deaf mother's attention, but then the interpreter says to the nurse, "I can't interpret what you're saying because she's not looking at me." And the nurse just says, "Okay," but then just keeps talking. When the deaf woman finally looks up, the interpreter now has to catch up on everything that the deaf woman missed while the nurse was talking the whole time. This is an example of knowing when the deaf person is ready for that attention and having the interpreter needing to mediate that communication between the nurse and the deaf mother. And that should be the nurse who is more attentive to the needs of visual communication and the deaf mother's needs. I do want to show this example before I go on. So, this is an example where the deaf mother and the nurse and the baby are all sitting on the floor. The nurse is looking at the baby on the floor, and as she leans down and the deaf mother leans down, the interpreter also leans down. So they're in a new position on the floor so that they still have visual access and eye and line of sight. At first, the nurse is blocking the line of sight between the interpreter and the deaf mother when the nurse initially leans down, but the interpreter automatically moves over to make sure that they still have that line of sight. And the nurse did not realize that she was blocking the visual conversation. I'll skip that example and I'll move now into the third article that I've published. This article is the second article primarily looked at interpreting. And then for this third article, I did not look at interpreting at all. I was focused entirely on the relationship and the dynamics between the healthcare providers, primarily the nurse, and the deaf women. I wanted to look more at their relationship, what the nurse says, and also what is not said. In this work, I saw that there were two primary areas. One is hegemony of spoken languages, and assuming that newborn babies need access to spoken languages more than sign languages. And the second area is interaction with other family members who are not deaf, that the nurse does not see and does not understand the importance of deaf culture and deaf relationships within the family. This is a quote. Here, the nurse is asking questions about whether the grandparents use spoken language and whether they can speak with the baby to give them spoken language input. And the nurse is asking whether the grandparents can help with spoken language for the baby. In this next example, this is also a quote. The nurse recognizes that the baby gets more spoken language stimulation from their older sibling who's hearing and says that's good for the baby, that there is spoken language at home and that it's not only sign language. And then here, this is again the nurses asking about a sibling who can hear and use spoken language, and asking whether the deaf mother has a TV that has audio on, so that again, they're worried about having access to spoken language for the baby. This is a similar quote where the nurse is recognizing that the baby makes strong eye contact and that that's good, but then she's asking the deaf mother if the baby can babble in spoken language. And again, the nurse is only thinking about sound input and babbling in spoken language, not in sign language. And then this last quote, and again, I see that time is almost out, so I'll keep this very short and we'll go to Q&A soon. Here, there's no need to read the quotes. I'll explain this briefly. The idea here is that the deaf mother says to the nurse that she sees the baby, and before she wasn't sure, but now she can understand what the baby wants at any time, whether her baby is hungry or needs to be changed or is tired. And she can see those signs from the baby now. And the nurse is expecting, like hearing women, to be able to hear different types of cries from their baby. But the deaf mom says, I can see this. I can see how the baby is behaving and respond to that. In the other example, the deaf mother is explaining that her baby sleeps in the car, and then when the car is stopped, the engine turns off, the vibrations stop, her baby wakes up. And even though the deaf mother is talking about feeling the vibrations of the car running, the nurse still says, oh, it's because your baby can hear that the car has stopped. So here, the nurse is not recognizing the visual or tactile cues that the deaf parents are recognizing, but instead is focused on a sound-based experience. Okay, this is my last slide, and then we'll start Q&A. Again, I'll explain these quotes. You don't need to read them. So in the first quote, the nurse is recognizing that the baby has very strong eye contact and is following the nurse as she goes around the room. And the nurse even says, oh, you've done an excellent job with eye contact, because the baby is making such good eye contact. And yet, the nurse is still not recognizing that that's normal for visual communication in a deaf family and a sign language using family. Okay, I think that's it. Yep.